Hello dosto, welcome to GrowMed. Welcome back to another session where we are discussing 10 most important topics from each subject so that these videos will help you in the last minute revision, and mostly you can expect 5 to 6 questions from each of this video. So this video contains mostly the high yield topics and along with that the previous year questions. So in this video we will be discussing about the anesthesia, and this is the first video which I am uploading for the anesthesia, and in this I have tried to cover all the important things. Matlab ki you will be watching this one video and one video will be sufficient for you in the last minute revision. The images, everything have been covered here, and if any point is missed then I will be sharing about it in my telegram channel. So join with me in the telegram channel. So from the anesthesias, the most important thing is the drugs. So classified into the muscle relaxants, then the local anesthetic and the general anesthetic, and repeatedly questions are asked on the side effects of these drugs and the uses. So we will look at all those things. The muscle relaxants, these are classified into the two categories, centrally acting and the peripheral acting. So the centrally acting are the diazepam, baclofen and the tizanidine. So these centrally acting drugs, the mechanism of action is that they will be acting mainly GABA receptor or the alpha receptor. So these two, ये जो दो है diazepam and the baclofen, these act on the GABA receptor, and this tizanidine, this will be acting on the alpha 2 receptor. Then the peripheral drugs classified again into directly acting and drugs which act at the neuromuscular junction. So the directly acting is the dantrolene, and this one is a must do topic. So dantrolene frequently questions have been asked, and this is a drug of choice for the malignant hyperthermia. See, remember the thing, this malignant hyperthermia, this is the drug of choice. The drug of choice is the dantrolene. Dantrolene will not cause the malignant hyperthermia. There are various other drugs, the succinylcholine, which will be causing this malignant hyperthermia, because there are various other drugs which will be causing this malignant hyperthermia, and we can get confused between these things, and we can mark the wrong answer if at all this question comes. So be particular about these questions, that dantrolene is the drug of choice for the malignant hyperthermia. Then the drugs that act on the neuromuscular junction, again classified into the depolarizing and the non-depolarizing. Depolarizing is the succinylcholine, which is the shortest acting anesthetic agent or the muscle relaxant, and this drug can cause malignant hyperthermia, as we had just discussed here, right? Dantrolene is a drug of choice, but succinylcholine will itself be causing this hyperthermia, and this also causes fasciculations, and it can also increase the potassium levels. So we need to use these drugs very carefully. Then non-depolarizing drugs ending with the curium and the curonium, like for example T-tubal curare, and then the curonium drugs, which are the pancuronium, pipercuronium. The important thing which you must remember is the differentiating factor, that curium drugs, these increase the release of the histamine, and these are not associated with the histamine release. So these are avoided in case of bronchial asthma. And two important things also which you must remember is the curium, atracurium and the cisatracurium, mivacurium drugs. These drugs undergo Hoffman elimination. So these are used in case of liver or the kidney damage. So one thing, important thing which you must remember. Then moving on to the local anesthetic, classified into the two categories, ester and the amide. So ester, these are the examples of the ester and how we will remember it. तो ईस्टर्स में देखो ए आई, वन आई विल बी कमिंग इन केस ऑफ द ईस्टर्स. तो ईस्टर के एग्जाम्पल्स के नेम में यू विल बी हैविंग वन आई, बट इन केस ऑफ अमाइड यू कैन सी टू आईज. तो लिग्नोकेन, ब्यूपीविकेन, प्रीलोकेन. ओके, सो दिस इज अ ट्रिक टू रिमेंबर दिस ईस्टर एंड द amide. This cocaine is very important. So I have covered the points related to this cocaine in the pharmacology part 2 video, where I have discussed everything about this cocaine. So I suggest you to watch that video also. Then the chlorprocaine is the shortest acting local anesthetic, and the most common agent used is the lignocaine, and this is used in case of digoxin induced ventricular fibrillation, and also used in case of MI, post MI ventricular tachycardia. That is used, the drug used is the lignocaine. bupivacaine. Then bupivacaine mainly acts on the heart. Prilocaine, the side effect it causes is the methemoglobinemia, and these are the other two examples. Dibutacane is the longest acting, so this was also a PYQ asked. Then the mechanism of action of this local anesthetic is that they will be acting on the open sodium channels. The toxicity, if there is local anesthetic toxicity, then these features can be seen: increase in the heart rate, decrease in the breathing rate, and arrhythmia, and treatment by giving the CPR and 20% intralipid emulsion. So another important thing which you must remember, that for the local anesthetics we will be giving the adrenaline to cause vasoconstriction, because all these local anesthetics, they are mainly the vasodilators except the cocaine. So cocaine is a vasoconstrictor, so along with this we will not be using the adrenaline, but with the rest other drugs we need to use the adrenaline to make it long acting to reduce the systemic toxicity. So this is also a PYQ, because questions are asked on this, that why will we be giving the adrenaline along with the local anesthetic. Then moving on to the general anesthesia. So general anesthesia also classified into two categories: IV, which are also called as the inducing agent. Inducing means we will be using this to induce the anesthesia, and for the maintenance we will be mainly using the inhalational method. So the drugs which are used for the induction are the thiopentone, propofol, ethomidate, and the ketamine. So these are the various drugs which are related to these things, and you need to remember it. So the thiopentone is the shortest acting, and it will be causing the bronchoconstriction. And this one is short acting because it has a rapid redistribution, so it will be redistributed rapidly in the body, due to which it will be degraded rapidly also. Then propofol, so the important thing, so this one is a PYQ asked from the propofol, and it is the drug of choice for the daycare surgery, contraindicated in case of shock, and the injection is painful. So P for propofol, P for painful. Then ethomidate, drug of choice for the CVS surgeries, and side effect is the adrenaline suppression. Okay, so this was a PYQ, that for CVS surgery, which of the following local general anesthetic we will be using, or which of the following general anesthetic is a safer alternative for the CVS surgery? It is the ethomidate. Then from the ketamine, the things which you must remember is, see, from the mnemonic itself, from the name itself, you can remember it easily. Used in case of kids, so drug of choice for kids. Emergence reaction, this will be causing emergence reaction. Then dissociative anesthesia it will be causing, and it will cause increase in the blood pressure, then increase in the intraocular pressure, and the increase in the ICP, due to which this one is not used in case of any condition like the glaucoma or the head injury. So ginger condition mein these things are already increased, in that we will be avoiding the ketamine. Then it is an MDA receptor blocker and a bronchodilator. So it is an excellent bronchodilator. So it is used in case of asthma. So these are the things which you must remember from the ketamine. Okay. Then inhalational agents. So inhalational agents, the N2, it has the maximum MAC. MAC is the the MAC, which is the minimum alveolar concentration, and it is highly with the NO2, due to which this will not be potent. So the potency is inversely proportional to this MAC. So more the MAC, less the potency, less the MAC, more the potency. Okay. Then moving on to the halothane. So halothane is contraindicated in case of CVS and the liver surgeries. Enflurane contraindicated in case of seizures, and isoflurane used in case of cardio and the CNS. See, this cardio का जो question है ना, this is very confusing, because they will be asking जानबूझ के, मतलब tricky बनाने के लिए, they will be asking it like this कि which of the following inhalational agent is used for the cardiac surgery, which of the following inducing agent is used. So do look at the questions asked, because देखो inducing आएगा तो the drug will be the CVS, बट अगर इन्हेलेशन पूछा देन इट विल बी द आइसोफ्लूरेन, और ऑप्शन में दोनों दे देंगे. अब हमने तो पढ़ लिया है कि सीवीएस में इथोमिडेट भी देंगे, आइसोफ्लूरेन भी देंगे. वहाँ पर ऐसा होगा कि वी विल बी गेटिंग इधर कन्फ्यूज, और या फिर हमारा दिमाग खराब होगा एक क्वेश्चन के पीछे. तो इसीलिए लुक एट द क्वेश्चंस दैट आर बीइंग डिस्क्राइब्ड इन द ऑप्शंस इन द क्वेश्चन एंड रूल आउट द ऑप्शंस. आराम से पढ़ना, ध्यान से पढ़ना, गड़बड़ाना नहीं है एग्जाम में. एंड इफ एट ऑल इफ यू आर नॉट एबल टू सॉल्व द क्वेश्चन, देन डोंट वरी अगर एक दो क्वेश्चन अगर आप सॉल्व नहीं कर पा रहे तो दैट डजेंट मैटर, क्योंकि इतने सारे 300 क्वेश्चन आर वेटिंग फॉर यू. डोंट वेस्ट योर टाइम ऑन वन क्वेश्चन. अगर वो आपसे नहीं बन रहा है तो जस्ट मूव, स्किप इट ऑन, एंड जो क्वेश्चन का आपको थोड़ा सा भी आइडिया है, इन्वेस्ट योर टाइम इन दोज क्वेश्चन. ओके, देन moving on to the desflurane, sevoflurane and the xenon. Sevoflurane used in case of the children and xenon is the ideal. तो ये तो हम यूज़ करते नहीं, xenon के बारे में तो सबको पता ही होगा. So this desflurane is irritant to the respiratory system. So in case of patient with these respiratory defects, तो उनमें हम ये desflurane यूज़ नहीं करेंगे. Okay, so these were the things which you must remember from the general anesthesia, local and the muscle relaxants, the drugs mainly. Then moving on to the some other important PYQs. So we will be discussing the PYTs here, and agar if at all questions जो है ना anesthesia में, they will be roaming around these topics only, because as it is a very short subject and hardly 5 questions will be coming from it. तो डोंट इन्वेस्ट मच टाइम इन इट. बस ये वीडियो एक बार दो बार देख लेना, ये PDF 2-3 बार पढ़ लेना, एंड जस्ट सॉल्व द FMG सॉल्यूशंस MCQs एंड you'll be easily able to score well in this anesthesia, because अभी ज़्यादा टाइम भी नहीं है ना. Focus more on those subjects which will help you to score in the exam, like the PSM, then the OBG, surgery, फिर ENT, ophthalmology. तो इन पे concentrate करना ज़्यादा. Then Malam Patti scoring. So this scoring is used to assess the size of the tongue for the laryngoscopy, and it is also used to assess the difficulty airway during the intubation. Classified into the 4 grades, class 1, 2, 3 and 4. So in the class 1, as we can see that all the things will be visible very clearly: hard palate, soft palate, uvula and the pillar. And then in the class 2 we will be only visible is the uvula. तो थोड़ा सा uvula visible है and pillar visible नहीं है इतना ज़्यादा. The hard palate is visible and the soft palate is visible. Then in the class 3 the uvula will not be visible completely, and only the hard palate and the soft palate are visible. And in the class 4 nothing is visible, कुछ भी हम differentiate नहीं कर पा रहे. ठीक है, so this is the scoring used for the Malam Patti, and image based question are asked on this. So do look at the images, मतलब अच्छे से images को रट के जाना, ताकि image based question आए भी तो you will be making it correct. Then another similar classification used is the Friedman classification. इसमें क्या होता है कि look at the tongue and the mouth. तो ऐसे अगर 4 image एक साथ आएंगी तो do look at the tongue and the mouth. इसमें क्या होता है कि mouth will be the open, but जो tongue है it will be inside the mouth, and in case of Malam Patti the tongue will be outside the mouth. Okay, then this is used to predict the outcome of the OSA surgery. OSA मतलब कि OSA meaning obstetric sleep apnea. So this is the classification used for the outcomes of this surgery. And this classification is also similar to that. So it will be complete visualization of the soft palate, then complete visualization of the uvula, then class 3 and the class 4. Then moving on to some important images asked in the anesthesia. So these are the various oxygen क्या बोलते हैं, oxygen supply करने वाले devices, oxygen supplying devices. And the first image, it is the nasal cannula. So these are the questions. See, these questions are asked कि इसकी FiO2 कितनी है and the maximum flow कितनी है. तो you need to mug up this whole chart. And for the nasal cannula it will be 6 liter per minute, and this is the image of the nasal cannula. मतलब simple रहेगा, and you can see here ये वाला appearance देखने को मिलेगा इसमें. Then simple Hudson mask. तो बस एक simple mask है और इसके साथ में एक wire attached है. That one is the mask. And simple mask, O2 mask का, this one is the maximum flow and the FiO2, which you must remember. Then this is the Venturi mask. So image based question asked multiple time. PYQ है ये Venturi mask का. Then this one is the O2 mask with the reservoir bag. तो यहाँ पर आप देख सकते हैं reservoir bag, and this one is the ambu bag. So this one is the also called as the bag and mask ventilation. And one important question from this is contraindicated in case of the congenital diaphragmatic hernia. ठीक है, then Moving on to the laryngoscope. So two type के laryngoscopes we must remember. The first image you can see is the mirror, in which you can appreciate the blades are straight. So used mainly in case of children, and this one is the Machintosh, and the blade is curved and used in case of adult. So by looking at the blades you can easily differentiate between the laryngoscope which is asked in the image. Then moving on, these are the endotracheal tube, and this is the parts of this endotracheal tube. Okay, तो ये सारे इसके पार्ट्स है. एंड दिस वन इज द डबल ल्यूमेन. तो यू कैन सी हियर दैट दो ल्यूमेन है इसमें, एक ईसोफेगस में जाता है, एक ट्रेकिया में जाता है, ऐसे करके है ये. ओके, तो द कफ और एक आता है कफ्ड ईटी. तो द कफ प्रेजेंट इन दिस एंडोट्रेकियल ट्यूब, द यूज ऑफ इट इज टू प्रिवेंट द रिगर्जिटेशन ऑफ द गैस्ट्रिक कंटेंट. ठीक है, तो इमेजेस अच्छे से देख लेना क्योंकि एनेस्थीसिया में मोस्टली दे विल बी आस्किंग द इमेज. एंड these are the laryngeal airway masks, and these are used to maintain the airway, and there are various types. तो दिस वन इज द LMA प्रोजिल. तो प्रोजिल में यू कैन अप्रिशिएट दैट यहाँ पर दो अलग अलग ल्यूमेन है. एंड देन दिस वन इज़ द LMA क्लासिकल. क्लासिकल में बस एक ही ल्यूमेन है. एंड दिस वन में यहाँ पर जो ये क्लिप है इसमें बस ब्लू कलर है, रेड कलर का कुछ नहीं है. एंड इस क्लिप में रेड कलर का आपको दिखेगा. Then moving on to the LMS Supreme. So Supreme will be totally transparent and white in color. So by looking at this, you can easily come to know that it is the LMS Supreme. Now LMA Guardian. Look at this part. This is a colorful. तो इसमें green, red और yellow है, and बाकी सब में तो blue ही है ना. So by looking at this and looking at this tube, you will be easily coming to know that it is a LMA Guardian, and this one is the LMA Flexible. फ्लेक्सिबल में इफ़ यू जूम हियर, आप यहाँ पर अप्रिशिएट कर सकते हो कि एक ट्यूब टाइप की प्रेजेंट है, मेटालिक ट्यूब विच विल हेल्प टू bend it, and this one is called as a LMA flexible. So these are the important images from the LMA. Then moving on to the vaporizers. So various vaporizers are used for these inhalational agents, and this desflurane, it has a special vaporizer. So this was the PYQ asked, and asked recently in the Jan 2024. ये जो exam में हुआ था, this image based question was given, and they had asked this, that this special vaporizer is used for which anesthetic agent, and the answer was the desflurane. Then the red one used for the halothane, then this purple isoflurane, and the yellow for the sevoflurane. So look at the images also and look at the color also, because image based अगर नहीं पूछा और अगर color mention कर दिया, then also you will be easily able to solve it. Then moving on to the circuit, Mapleson breathing circuit. So these are the breathing circuits, and these are mostly the flow control circuit. So by using this circuit, we can control the flow of the CO2 into the patients, and also the flow of the carbon dioxide and the oxygen in the patient. So this is the type A, Mapleson A, and what happens in this is also called as the McGill system. And इसमें क्या होता है कि देयर विल बी एन एडजस्टेबल प्रेशर वॉल्व प्रेजेंट एट द पेशेंट्स एंड. सो इट इज़ द एडजस्टेबल प्रेशर वॉल्व. ठीक है. देन बी में क्या होता है कि there are two components present in this, the APL, that is the adjustable pressure valve, and this one is the fresh gas. So both are present at the patient's end in the Mapleson. So you can remember that Mapleson B, both APL and the FG, and this one APL, Mapleson APL. A में जो है it will be the APL A. ठीक है, तो ऐसे में you can remember it, and this is also called as the McGill system. Then the C, Mapleson C में क्या होता है कि it is just like B, but it is coagulationless and it is compact, and this is used in case of the emergency intubation. Okay, so look at the circuit also, because image based question can also be asked. Then the Mapleson D. तो Mapleson D में क्या होता है कि the APL is located distally, and this one is also called as the Bain system. Okay, then यहाँ पर you can remember that Maple D से distally, located distally, APL. तो जो भी हम बात कर रहे हैं ना, that one is mostly on the APL, that is the adjustable pressure limiting valve, and this one is also called as the Bain system. Then the E. तो Mapleson E में क्या हो रहा है कि the end is eliminated, so there is no RB at the end, and this Mapleson E, also called as the Ayers T, peas. So you can remember it like meat, MEAT, ayers, maple E, ayers, TPs. Okay. Then maples in F. So we will be looking at the free form of the APL, and this one is also called as the Jackson-Rees modification, and this one is most commonly used in case of a pediatric patient. Then these also are some important things which you must remember, that A is used for the spontaneous ventilation, D is used for the controlled ventilation, E is the bagless or the valveless, as we had discussed here, and eliminated, no RB at the end, so it does not have any bag. Then F is used for the pediatric patient. Okay, so these are the breathing circuits which I used, and just remember these things which I had discussed. Now no need to go much deep into it, because question आ भी सकता है, नहीं भी आ सकता है, and अगर आ भी गया तो if you do it correct okay, and अगर गलत हो भी गया तो इतना फर्क नहीं पड़ेगा, क्योंकि बस एक ही मार्क का तो है. Then moving on to the pin index and the color coding. So this is a must do topic from the anesthesia. So these are the various gases used, and these are the color coding of it along with the pin index. So जो air है, it will be stored in a gray color body, and shoulder will be white and black, and the pin index is 1.5. Likewise for the oxygen, it will be black and white, and 2.2 and 5 is the pin index system. So you need to mark up this whole chart. Then image based questions have also been asked on this. So they'll be giving this cylinder, and you need to look at the color of the cylinder, and after that just recall this table, analyze it, and then try to answer the question. So the PISS, which is the pin index system, stands for pipeline to the system, connection of the gas cylinder to from the pipeline to the system, and DISS, which stands for the diameter index, so the attachment of the cylinder to the machine. Okay, then moving on to the ASA classification. So this ASA classification stands for American Society Anesthesiology, and this is mainly used to look at the comorbidity of the patient. So when we will be giving the anesthesia, to look at the comorbidity, this one is used. So classification, if the patient falls under the category 1, then he is considered as the healthy patient. Then 2, mild to moderate systemic disease caused by the surgical condition or by other pathological processes and medically well controlled. मतलब कि there are comorbidities present, but these comorbidities are under the control, mild comorbidities. Then 3 will be the severe disease. So the disease is very severe and severe comorbidities are present. Likewise, if it is category 4, then severe impacting disease progress that is consent threat to the life, मतलब कि life threatening comorbidities present है patient में. Then 5 में there will be the thing that जो comorbidity से they are extremely very much high, मतलब हमको surgery करनी ही पड़ेगी. If we do not do the surgery, then the patient will die. So this condition will be called as the ASA 5 category, and 6 will be declared brain dead patient. So this is the ASA which you must remember. And then moving on to another very important topic, the capnography. Image based questions are asked on this capnography. So we will look कि various condition में किस type की capnography दिखेगी. Okay, so you can appreciate that in the first graph, this appearance looks like a shark fin appearance, so upsloping of the phase 3, and this one is seen most commonly in case of bronchospasm. Then CO2 rebreathing, this is seen in case of CO2 rebreathing, this graph. तो यहाँ पर मतलब है कि this is the baseline and this one is the line of the graph. So due to presence of the CO2 already in the lungs, here the patient is rebreathing the CO2 and not able to intake the oxygen. ठीक है, so the baseline gases will be increased. Then this cleft, curare cleft, seen with case of return of the spontaneous ventilation. Then in case of hypoventilation, we can see this graph, the CO2 retains and the graph increases, so the graph will be increased. And then hyperventilation में we can see this graph, so the graph की जो वो है वो बहुत छोटी छोटी हो गई है ना, it has the size of the graph is reduced. तो दोनों में opposite है. See, in hypoventilation it will increase, in hyperventilation the size of the graph will reduce. Then in case of malignant hyperthermia, the height will increase due to hypermetabolic state. Okay, So this is seen in case of the malignant hyperthermia, and in case of air embolism we can see this kind of graph, and what it says is there will be sudden intraoperative sudden drop of the CO2 in case of air embolism, and we can see this graph. And one important thing is this capnography, मतलब कि we are monitoring the CO2 levels, and this is also used to assess the intubation, कि मतलब हमारा intubation जो हमने किया है वो successful है या नहीं है, वो भी पता लगा सकते हैं हम using this capnography. So these are the important things which you must remember from the anesthesia. And uh, so this was a quick revision video for the anesthesia, and almost all the PYQs I've tried to cover in this video, so that this one video you will be watching for the anesthesia and आपको दूसरे कहीं पर भी जाने की ज़रूरत नहीं है anesthesia के लिए. And hope so this will help you all in your revision, and it will help you in scoring good marks from the anesthesia. So thank you so much guys for watching this video. If at all you have watched the anesthesia, मतलब अगर आपने पहले ही भी anesthesia पढ़ा हुआ है, then you can refer your notes also. There's no harm in that. This video is mainly for those who have not done the anesthesia even once and worried about कि कहाँ से करना है, कैसे करना है. तो watch this video at least two times and revise the notes 2-3 times and solve the solutions, FMG solutions, PYQs. So thank you so much guys for watching this video, and all the best for the FMG. So as we are left with a very short time, and at this time a lot of things will be going on in the head कि कैसे करना है, क्या करना है, but don't worry, keep all those things aside and whatever you feel is correct for you, go with that. So thank you so much once again. Bye bye.